Thank you for calling in. We'll give you the floor for a moment, and and thank you for being flexible and making time to be with us. And if you have additional time after you give us some commentary, we'd love for you to take some questions if you could.
Yeah, sure. And my new meeting was just pushed off a bit, so I have a little bit more time.
Thank you, Liz.
So, should I start?
Please, yes. We'd love to hear your comments.
Well, I guess the first thing is I just want to say how disappointed I am and really, truly sorry that I can't be down there in person. I guess it's just unfortunate happenstance that the House budget was released today, and so it just was impossible to get away. But I had really looked forward to the meeting, not just to seeing Marty and others at the round table, but also meeting members of the Gold Standard in the round table and talking about all the great things that you're doing. I want to say first that I was introduced to the round table by Nancy Ann DeParle, the Deputy Chief of Staff here, and she said to me, she pulled me aside and said, "You're really going to like this group. They're really something special." And she was right. I haven't worked with the CEO roundtable very long, but what struck me ever since the first time I met with Bill Weldon and Bob Ingram and Marty Murphy is how important your work is and also how unique this organization is. Your work is important because you draw attention to critical issues related to cancer prevention in a very comprehensive approach. In the 5 pillars really captures virtually all aspects of cancer prevention, and your Life Sciences Consortium focuses on so many issues that are relevant to making sure that the U.S. retains its position as a global leader in medical innovation, which is really critical right now. And you're also unique because you are an organization driven by CEOs who can take ideas and change and really implement them across a really broad range of and spectrum of companies. And of course, under Marty's expert leadership, it seems to me that anything is possible. So I also want to tell you that the administration explored whether the White House could be certified as meeting the gold standard, and as some of you might know, we went through pretty extensive discussions with the Office of Personnel Management and the Secret Service about the standards. And the one aspect that tripped us up was prohibiting smoking on the premises. And if you can imagine having a foreign head of state who smokes, or, for example, the Speaker of the House, having to ask them to extinguish their cigarette or walk out to 17th Street into the public space in order to smoke, you can understand why that didn't end up being possible. But we are still looking at ways of trying to work together in other areas. So if I was there in person, I had wanted to say a few things about the Affordable Care Act and just talk a little bit about how many aspects of health reform are aligned with the gold standard. I'll mention just a couple and not too much detail, but I think the ones that are most important are the focus on wellness and prevention. In the private sector, the Affordable Care Act requires all health plans, including group health plans, unless they're grandfathered health plans, to provide free preventive services. And we know in 2011 that benefit was extended to 54 million Americans who might not have had the benefit in the past. This should make it easier for companies and organizations to meet the gold standard. In Medicare, starting last year, Medicare now covers all recommended preventive services with no cost sharing, and a new annual wellness visit that includes a personalized prevention plan where your physician will talk to you about what screenings you need to have or what you will need to have over the next 5 years, talk about nutrition and ways to stay active. And we know in 2011 that 32 million Medicare beneficiaries accessed either a free preventive benefit or the annual wellness visit. And then wellness, and I think this was one of the most important aspects of reform for the business community, and that was the provision to permit employers to vary insurance premiums or provide rebates or rewards by up to 30% of the cost of health coverage for employee participation in health promotion and disease prevention programs. And so the real focus on wellness, I think, was very important to a lot of the employers that came in and talked to us about what they wanted out of reform. In terms of the coverage expansion, it's obviously covering the uninsured is very important, but I can report that in the short term, the pre-existing condition insurance program that operates, it started in 2010 in the fall and extends through 2013. It provides subsidized coverage for people who have a pre-existing condition and have been uninsured for 6 months. The program now has over 50,000 people, and last month HHS published a report about who's enrolling in the program, and what we found is that a very high proportion of patients with cancer and other very serious health conditions like need for a transplant are the ones who are enrolling in this program, people who've put off care for a very long time. We've estimated that 27% of total expenditures so far have been spent on patients with cancer, and the average per capita spending in the program is about $29,000 per enrollee, which is more than twice that of high-risk pools. And then just finally, aspects of the new law that were really important to the cancer community were some of the patient protections that prohibit discrimination by health plans based on health status starting in 2014. Insurers are prohibited, and this was starting in 2010, from applying lifetime dollar limits on coverage, and annual limits are restricted, phasing out and then ending in 2014. And again, these were things that were really important to people with cancer. In terms of FDA-related issues, I wanted to give Peggy Hamburg a lot of credit. She has a very tough job. I've decided the more I watch her, she has one of the hardest jobs in Washington. The FDA, of course, must ensure patient safety, but at the same time, the agency is mindful that as a country, our collective goal is to foster rather than hinder medical innovation. And I think in the past few months, FDA has indicated very clearly and very publicly in a number of ways that it cares a lot about fostering innovation. And one of those ways is a report they released last October, Driving Biomedical Innovation. And I won't go through the report in too much detail, but it identified 7 areas where the agency could undertake reforms to help reinvigorate the industry's quest for new state-of-the-art medical products. And one of those ways is, of course, streamlining and reforming their regulatory process. In terms of how FDA is doing, Janet Woodcock testified recently at a congressional hearing reporting that in FY 2011, fiscal year 2011, FDA approved 35 new groundbreaking medicines. This was the second highest number of annual approvals in the past 10 years, surpassed only by 2009. Some of those new medicines include a drug for late-stage prostate cancer, the first drug for Hodgkin's lymphoma in 30 years, and the first drug for lupus in 50 years. The time from submission to approval of new drugs has been cut to an average of 1.1 years. That's down from 2 years in 1992. And compared to the EU, of 57 novel drugs approved by the FDA and the EU between 2006 and 2010, 75% of those, or 43 of those drugs, were approved first here in the United States. The last aspect along these lines that I wanted just something to mention that I thought was very consistent with the Life Sciences Consortium is the new National Center for Advancing Translational Sciences, and this was something that I think is very important to Francis Collins. The budget last year included $30.7 million for NIH to establish the new center. I think I have that number right. And a small increase for NIH. But the goal of the center is to develop new ways of doing translational research in a way that the research and development communities can adopt. The innovations are intended to cut down on the time and expense needed for developing a new drug and to predict with more certainty which compounds are going to work best and be safer earlier in the development process. These are exactly the kinds of things that the Life Science Consortium is talking about. Already the center has formed a partnership with DARPA and FDA to develop a chip that mimics human tissue for more predictive drug screening, as well as early efforts to streamline rescuing and repurposing of drugs and validation of promising drug targets. Other initiatives include the pharmaceutical collection, the National or NPC, which is a comprehensive resource of 3,800 approved and investigational medicines to facilitate repurposing of medicines. The Learning Collaborative, a cross-sectional collaboration to repurpose approved drugs for use in leukemia, and then the NIH Industry Compound Rescuing Initiative, which would match compounds from pharma's virtual medicine cabinet with NIH-funded scientists' innovative ideas for new uses. So those were a few things that I wanted to talk about, probably in a little bit more detail if I was there, but I just want to close by saying that your efforts and leadership continue to bring us closer toward the elimination of cancer, and as your motto says, may you do so in as bold and venturesome way as possible. So I, again, am sorry I'm not there in person, and I hope that the meeting has been productive and successful, and look forward to a continuing partnership.
Thank you.
Liz, I hope you heard those applause, Liz. This is Marty Murphy. I've guaranteed you now a higher place in heaven.
You keep saying that. I don't know.
On behalf of our chairman, Chris Wiebacher, who unfortunately is only lavalier microphoned and not hard microphoned, and therefore cannot speak, at least through the microphone, let me say on behalf of everyone here how grateful we are for your leadership and that of Nancy Ann DeParle, and how we look forward to not only a continuation of this partnership, but also the inspiration that you personally bring to all that you do and to your CEO Roundtable on Cancer. Thank you, Liz.
Thank you, Marty. Well, I'm happy to answer questions if anyone had any specific questions. I know you can't see me, and I can't see you, but if anyone had anything they wanted to ask, I'd be happy to answer. And I'm also available if anyone has any questions later. I can give you my email address, and if you want to shoot me an email and just ask about something that we're doing or something we should be doing, or if you have ideas on what we could be doing better, I can give you my email address if that's helpful.
Yes, this is Dennis Gillings. I was curious how in the administration it's thinking of the evolution of personalized medicine, which promises a lot of research and innovation from the point of view of the biopharmaceutical sector, but not clear how it might be looked at from a policy perspective at your end.
That is a good question. I think it's something that I know Francis Collins is paying attention to it, because I've had a conversation with him in the context of how you think about personalized medicine in the context of comparative effectiveness research, and making sure that personalized medicine is recognized and part of that process. And then the second thing I would say is in the FDA report from last October, I think Peggy Hamburg has specifically called out personalized medicine and talked about the need for FDA to build the infrastructure to drive support and support the development of more personalized medicines, including investments in regulatory science and clarifying the agency's policies. So I know it's something that they're looking at.
Go ahead, Joe.
I guess I have to hold this down. Just a couple of quick comments, if you care to opine. Tying economics and healthcare together, an issue is really around immigration reform, and how many people are trained as PhDs and MDs in the U.S. that are summarily sort of kicked out to go and compete with us around the world in terms of entrepreneurial ventures. I think that's a part of the solution. And I'm sure you've thought about this before, but there is an awful lot of money sitting in Europe that could be brought back to fund cancer research and innovation, if you care to comment. Thank you.
So on the first issue, I remember the Finance Committee when I was working on in the Senate. In 2008, we held a congressional-wide hearing. We invited all members of the House and Senate, and one of the speakers was Craig Ventnor, who specifically called out the immigration issue and said, you know, we really need to rethink our immigration policies because we're losing a lot of bright and excellent minds to other countries by our current policies. It wasn't something that we adopted in health reform, partly because the committees of jurisdiction that were involved in health reform didn't have jurisdiction over those issues, but I think it's something that has been raised a number of times and in a number of different contexts as being very important to make sure we maintain our edge in innovation. The second issue, I assume you're referring to the territoriality tax issue. And if that's the case, I know the President does not support that policy. It's something that is in the House budget that was released today. It's not something that we support. I know that we're looking at other aspects of tax reform, but I think that particular provision is not something that we support.
Liz, this is Chris Feebacher. Can you hear me?
Yes?
Oh, good. This mic works now. Liz, we had a very interesting panel this morning on our gold standard, which, as you know, encourages the work-free, smoke-free work environment, and you know it well because of trying to get that for the White House. It was very clear that the conclusion of the group is that there are still a number of barriers that we certainly believe with our 3 million people cover that we can learn an awful lot about those barriers. We have to have some very adult conversations around the factors behind that. There's factors of the environment, there's factors of evolution in here. And I have to say that if we could get the White House really accredited on the gold standard, this would be hugely a huge signal to the importance of actual prevention and the importance of eating better and getting more activity as a real sign that this is the way forward in healthcare. So you certainly have my personal commitment that we're going to try to come back and work with you, because I think this would be such a big message to the country about where we need to go with healthcare.
Well, I had some other ideas on the gold standard, and I've talked to Marty about them, and I don't want to give up. We did run into a Secret Service security problem, but that doesn't mean we have to stop there. I think we can keep looking. And I agree. I think we need to do more in this area. I don't know if you've seen the advertisements that the FDA, the warning labels that they would like to be putting on cigarettes, and that the appellate court upheld, I think earlier this week, or maybe it was yesterday, or the days are sort of running together, so I'm not sure what day that was, but very recently. And the other aspects I think are important as well. One of the little-known pieces of health reform is menu labeling. We're working on regulations that will require restaurants with 20 or more chains to start posting information about calories and fat content and cholesterol, so that people can know more about what they're eating. And I don't know if you've ever gone to a restaurant in New York with such information posted, but I have, and I can tell you it absolutely changed what I ended up eating that day. So, we are committed to that, all of those ideas, and hopefully we can find a bigger and bolder way of showing that commitment.
Well, you should know that we have Dr. Marcus Plescia here of the CDC, and we're very happy to recognize the accreditation of the CDC for the gold standard. And he's also obviously within the Centers for Disease Control, supporting the very things that you talked about. So, I think what we've recognized that this is a community effort. It's not just government, it's not just the private sector. There is a value certainly in worksite engagement on this, but we certainly greatly appreciate your support and your leadership on this subject at the White House, Liz.
Thank you. Well, I think the thanks goes definitely in the other direction. I think you've done more to draw attention to these issues than most organizations, and at a level that really grabs people's attention and really makes changes.
Well, on behalf of everybody here, we know how busy you are with the health budget, and that's extremely important. So the fact that you've taken time to talk to us today is greatly appreciated by everybody. So once again, thanks very much, Liz.